Our body's health is a complex reflection of our habits, environment, and genetics. Among the many signals our body can send to indicate that something isn't right, there are some that deserve special attention. Firstly, significant changes in weight without a clear explanation can be a warning sign. Sudden weight loss may indicate conditions such as thyroid problems, diabetes, or even more serious diseases like cancer. On the other hand, unexplained weight gain can also be concerning, potentially indicating hormonal disorders, heart problems, or other health conditions. Another critical sign is extreme fatigue that does not improve with rest. This type of tiredness can be indicative of anemia, thyroid problems, or heart failure. Moreover, changes in skin or hair can also reveal underlying health issues. For example, very dry skin, changes in skin color, or hair loss can be signs of hormonal imbalances or nutritional deficiencies. Persistent pain or discomfort anywhere in the body, especially if it does not disappear with conventional treatments, can be a sign of inflammatory conditions, undiagnosed injuries, or even chronic diseases like arthritis. Changes in sleep patterns, whether difficulty sleeping or sleeping excessively, can also indicate mental health issues, such as depression or anxiety, in addition to possible sleep disorders. Paying attention to these signs and seeking medical evaluation can be crucial for the early detection of health problems and the initiation of appropriate treatment. Changes in weight without apparent cause are clear signs that something may not be functioning correctly in the body. A significant gain or loss of weight occurring without intentional changes in diet or physical activity level deserves medical attention. These changes can be symptoms of various health conditions, some of which may be serious. Thyroid disorders, for example, can affect metabolism, leading to rapid weight loss or gain. Hypothyroidism, characterized by low thyroid activity, can cause weight gain, while hyperthyroidism, with excessive thyroid activity, can result in weight loss. Additionally, diabetes, especially if undiagnosed or poorly managed, can lead to unexpected weight loss, while some forms of cancer can also manifest initially through significant changes in body weight. Besides the mentioned conditions, other systemic diseases, such as cardiovascular and gastrointestinal diseases, can also unexpectedly influence body weight. Heart failure, for example, can cause rapid weight gain due to fluid retention, while digestive disorders can lead to weight loss due to poor nutrient absorption. It is essential not to ignore such signs and seek medical evaluation to determine the underlying cause of weight changes. Early diagnosis and appropriate treatment of these conditions can significantly improve the quality of life and prevent serious complications. Therefore, any significant change in weight, whether an increase or decrease, without a clear explanation, should be seen as a sign that it is time to consult a healthcare professional. Feeling constantly tired or exhausted, even after a long period of rest or a good night's sleep, can be an indication that something is not functioning well in your body. This type of fatigue, known as extreme fatigue, goes beyond the common tiredness after a busy day or intense physical activity. It persists and seems not to be relieved by rest, potentially significantly impacting the person's quality of life. Extreme fatigue can be a warning sign for various health conditions, including anemia, characterized by a lack of healthy red blood cells to carry adequate oxygen to the body's tissues, leaving the person feeling constantly weak and tired. Other medical conditions can also be the root of this type of persistent tiredness. Thyroid problems, for example, can significantly affect the body's energy levels. Hypothyroidism, a condition in which the thyroid does not produce enough hormones, can cause fatigue, along with other symptoms such as weight gain and sensitivity to cold. Heart diseases are another potential cause of extreme fatigue, as they can prevent the heart from pumping blood efficiently, resulting in lower oxygenation of the body and consequently more tiredness. It is crucial to pay attention to this type of fatigue and consult a doctor to identify the underlying cause and receive appropriate treatment. Changes in the skin, such as the appearance of new spots, changes in existing moles in terms of color, size, or shape, or wounds that take a long time to heal, can be important health indicators that should not be ignored. These changes can be early signs of skin cancer, one of the most common forms of cancer. Skin cancer, including melanoma, which is the most serious type, can manifest precisely through these changes. Therefore, it is essential to regularly observe the skin and seek medical advice when noticing any suspicious changes. Early diagnosis and treatment of skin cancer significantly increase the chances of recovery, making skin surveillance a crucial part of healthcare. In addition to signs that may indicate skin cancer, other symptoms such as dry skin, intense itching, or yellowing also deserve attention, as they can be symptoms of liver or kidney problems. Dry skin and itching can result from a variety of conditions, including dehydration or allergic reactions. But when persistent, they can signal more serious diseases. The yellowing of the skin and eyes, known as jaundice, is particularly concerning, as it can indicate liver problems, such as hepatitis or cirrhosis, as well as issues related to kidney function. These conditions can affect the body's ability to filter toxins and regulate fluids, reflecting directly on the skin's condition. Therefore, it is vital to seek medical guidance when experiencing any significant changes in the skin to ensure an accurate diagnosis and appropriate treatment. Constantly facing digestive problems, such as bloating, abdominal pain, constipation, or diarrhea, is a clear sign that something is not functioning correctly in your digestive system. These symptoms, often disregarded or attributed to stress or diet, can actually be indicative of more serious underlying conditions that require attention. Food intolerances, for example, are a common cause of digestive discomfort. These conditions occur when the body has difficulty digesting certain foods, resulting in a series of adverse reactions, including gas, bloating, and abdominal pain. Identifying and avoiding specific foods can be crucial to alleviate these symptoms and improve the quality of life. Moreover, inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis, represent another spectrum of serious conditions that can be behind persistent digestive symptoms. Characterized by chronic inflammation of parts of the gastrointestinal tract, these diseases can cause intense and debilitating symptoms, requiring specialized diagnosis and treatment. Effective management of these conditions often requires a multidisciplinary approach, involving medications, dietary changes, and in some cases, surgical procedures, underlining the importance of an accurate medical evaluation for appropriate treatment and improvement of quality of life. Even more concerning, the persistence of digestive problems can be an early sign of gastrointestinal cancer. Symptoms such as persistent abdominal pain, changes in bowel habits, unexplained weight loss, and a feeling of fullness after eating small amounts may indicate the presence of a malignant condition affecting the digestive system. Gastrointestinal cancer requires early detection and intervention to increase the chances of successful treatment and survival. Therefore, it is crucial to take any prolonged change in digestion seriously, seeking immediate medical evaluation to determine the cause and begin the most effective treatment possible. Changes in urinary or fecal habits are more than just daily inconveniences. They can be early indicators of underlying health conditions that require medical attention. Changes in frequency, color, odor, or appearance of urine and feces are not normal and can signal everything from infections to more serious issues such as renal or hepatic dysfunctions. Urine can reveal a lot about a person's health state, with changes in color potentially indicating dehydration, or in more serious cases, kidney diseases. Similarly, an abnormally strong odor can be a sign of a urinary tract infection. As for feces, significant changes in color, consistency, or the presence of blood can point to serious digestive or gastrointestinal problems. Renal problems, for example, can cause changes in the appearance of urine, making it foamy or exceptionally dark, while liver issues can lead to pale or discolored feces and dark-colored urine. These changes are reflections of dysfunctions in the body's processing and elimination of substances, indicating that something is wrong. Additionally, urinary tract infections, UTIs, can not only alter the odor and color of urine, but also increase the frequency and urgency of urination, accompanied by pain or discomfort. These symptoms require medical evaluation for appropriate treatment, avoiding major complications. More worryingly, changes in urinary or fecal habits can be symptoms of bladder or colon cancer. The presence of blood in the urine can be an early sign of bladder cancer, while changes in the consistency of feces, difficulty in evacuating, or blood in the feces may indicate colon cancer. Both conditions are serious and require early detection for more effective treatment. Therefore, it is crucial not to ignore these changes and consult a doctor immediately for a complete evaluation. Early recognition and intervention are fundamental for a better prognosis and can save lives. Experiencing persistent pain, one that extends beyond a few weeks, serves as a clear signal that the body is facing something out of the ordinary. When pain becomes a constant presence in a person's life, resisting conventional methods of relief, such as over-the-counter medications, rest therapies, or alternative treatments, it is crucial to pay attention. This type of pain can be indicative of various chronic conditions, ranging from joint problems like arthritis and inflammation that brings pain and stiffness, to more complex and diffuse conditions like fibromyalgia, characterized by widespread musculoskeletal pain, fatigue, and memory and mood issues. Besides these conditions, persistent pain can also be an early sign of cancer. The nature of the pain can vary depending on the type of cancer and its location in the body, being constant or intermittent, but it is always a symptom that should not be ignored. Specific cancers, such as bone cancers, can cause notable pain in the affected area, while other types may press on nerves and other structures, causing pain in distant regions. The importance of an early diagnosis cannot be underestimated, as early detection and treatment can make a significant difference in the prognosis and quality of life of the individual. This may include a combination of medications, physical therapies, lifestyle changes, or even surgical interventions, depending on the underlying condition. Ignoring the pain or delaying seeking medical help can not only prolong the suffering but also increase the risk of long-term complications. Therefore, attention and immediate action in the face of persistent pain are essential for preserving health and overall well-being. The experience of shortness of breath that occurs without effort, also known as dyspnea, is a worrying symptom that can arise from various health conditions, some of which may be serious. When breathing becomes difficult in the absence of intense physical activities, it may indicate underlying problems that require medical attention. Heart diseases, for example, can cause shortness of breath due to the heart's inability to pump blood efficiently, leading to fluid accumulation in the lungs. Similarly, pulmonary conditions such as asthma, chronic obstructive pulmonary disease, COPD, pneumonia, or even pulmonary embolism can restrict airflow and gas exchange in the lungs, resulting in breathing difficulties. In addition to heart and lung diseases, anemia can also be a cause of shortness of breath. This condition is characterized by a deficiency of healthy red blood cells in the blood, compromising the transport of oxygen to the body's tissues and organs. Anemia can lead to a feeling of generalized tiredness and weakness, in addition to shortness of breath, even during light activities or at rest. Other symptoms, such as pale skin, dizziness, and rapid heartbeat, may accompany shortness of breath in these cases, suggesting that the body is not receiving enough oxygen. It is essential that anyone experiencing persistent or severe shortness of breath, especially if accompanied by other symptoms, seek medical evaluation as soon as possible. An accurate diagnosis is crucial to determining the underlying cause and initiating appropriate treatment. Depending on the diagnosed condition, treatment can vary from medication therapies, lifestyle changes, to more specific interventions, such as surgeries or procedures to treat the underlying disease. Ignoring shortness of breath can lead to serious and potentially fatal complications. Therefore, paying attention to this symptom is an important step in maintaining health and well-being. Sudden changes in vision, such as blurred vision, vision loss, or double vision, are warning signs that should not be ignored, as they may indicate the presence of serious ophthalmological conditions or other systemic diseases. Vision is one of our most valuable senses, and unexpected changes in its quality can significantly affect quality of life, besides potentially indicating health problems that require immediate intervention. For example, glaucoma, a condition characterized by increased ocular pressure that can damage the optic nerve, often does not show symptoms in the early stages, but can lead to noticeable visual changes as it progresses. Similarly, age-related macular degeneration affects central vision, crucial for activities such as reading and recognizing faces, making early diagnosis and treatment essential. Diabetes is another significant example, as it can lead to diabetic retinopathy, a complication affecting the blood vessels of the retina that can result in vision loss if not properly managed. Early detection of these conditions through regular eye exams is crucial to prevent irreversible damage to vision. Additionally, double vision or sudden vision loss can be symptoms of a stroke, representing a medical emergency that requires immediate attention. These symptoms may indicate the occurrence of a stroke or be a warning of a possible future stroke, highlighting the importance of urgent neurological evaluation. Therefore, when experiencing any change in vision, it is imperative to seek medical evaluation without delay. Ophthalmologists and other health professionals can perform diagnostic tests to determine the underlying cause of these visual changes and recommend the most appropriate treatment. Whether through medication, surgery, or other interventions, the goal is to preserve vision and prevent further complications. Ignoring warning signs can lead to serious consequences, including permanent vision loss, underlining the need for immediate attention and care for ocular health. Maintaining a healthy lifestyle is a fundamental strategy to prevent a wide range of health problems. A balanced diet, rich in fruits and vegetables and low in processed foods and sugars, provides the body with essential nutrients for optimal functioning while reducing the risk of chronic diseases such as obesity, type 2, diabetes, heart disease, and certain types of cancer. Besides nutrition, regular physical exercise plays a vital role in maintaining cardiovascular health and strengthening the immune system. Managing stress through relaxation techniques, such as meditation and yoga, is also important for maintaining mental and physical balance, contributing to the prevention of stress-related health problems like hypertension and depression. Besides adopting healthy habits, undergoing regular medical exams is essential for the early detection of any health issues. These checkups allow healthcare professionals to identify warning signs and conditions at early stages, when they are more easily treatable. Therefore, upon noticing any of the concerning signs mentioned earlier, such as changes in vision, persistent pain, or changes in urinary or fecal habits, it is crucial to seek medical evaluation immediately. Ignoring these signs can not only worsen the underlying health condition, but also decrease the chances of successful treatment and complete recovery, highlighting the importance of active prevention and quick response to any health warning signs. And so, we journey together, unveiling layers, exploring the unseen, and questioning the unquestionable. But remember, each answer found paves the way for new questions. Each story told opens doors to countless others still hidden in the shadows of the unknown. I wonder, what else is out there, waiting to be discovered? What new perspectives and challenges does the future hold for us, and how will they transform the way we see the world and ourselves? Our adventure may seem to have come to an end, but in reality, it is just the beginning. The invitation is open for you to continue questioning, exploring, and discovering. What will you do with the revelations of this moment? How will you apply these new insights to your life, to your mysteries, and to your quests? Remember, the extraordinary is not just all around us, but also within us, waiting to be unlocked. Until next time, keep curious, keep seeking, and never stop marveling at the wonders of our world. What will you discover next? What